We spend every second of our lives inside our bodies, yet most have no idea how to read the gauges on our internal dashboard. We force down gallons of water because we assume more is always better. We lie awake in the dark, convinced a nighttime trip to the bathroom means our health is failing. And we quietly worry when the spontaneous physical spark we felt early in a relationship starts to fade. Because we don't understand our baseline physiological metrics, we frequently mistake perfectly normal biological functions for medical emergencies. To actually improve our daily health, we need to stop guessing. We have to look under the hood and decode the exact mechanical reality behind three of our most misunderstood biological signals: how we hydrate, why we wake up at night, and how we experience physical desire. Developing this kind of body literacy is the dividing line between living in a constant state of anxiety over false alarms and taking actual, informed control of your long-term well-being. It's common to see people carrying massive water jugs everywhere, operating on the assumption that the human body requires relentless, maximum fluid intake to function. But forcing extreme amounts of fluid through your system without replacing electrolytes can actually dilute the sodium levels in your blood. In rare cases, usually seen in endurance athletes, this triggers a dangerous condition known as hyponatremia. Hyponatremia occurs when the concentration of sodium in your blood drops so low that your cells begin to swell. This diagram shows the body's highly accurate built-in fuel gauge for hydration, a vertical scale of urine color. You don't actually need to track ounces throughout the day because your system is constantly outputting this data. If the color lands in the middle, a light yellow, your hydration is adequate. If it shifts to completely clear, you're likely drinking more water than necessary. And if it drops to dark yellow, your system signals an immediate need for more fluids. Maintaining proper hydration doesn't require forcing arbitrary quotas of water into your stomach. It simply requires trusting your natural sense of thirst and checking the color-coded output your body provides. That fluid intake eventually has to go somewhere. And for adults over 55, shifting hormone signals naturally cause the kidneys to produce a higher volume of urine during the night. We can see the strict mechanical limitation of human plumbing in this cross-section of an adult bladder. It can only hold roughly 16 to 20 ounces of fluid before it reaches its absolute capacity. When that volume hits the upper limit, your body sends an alert to wake you up. Experiencing this single interruption once per night is a perfectly normal biological response to a full tank. However, waking up multiple times every single night is an entirely different signal. Frequent disruptions point toward external issues that require evaluation, such as an enlarged prostate, an overactive bladder, or a sleep disorder like apnea. A single nighttime trip to the bathroom proves your system is working, but navigating a dark house poses a severe fall risk for older adults. You can mitigate this physical danger by strictly cutting off all fluid intake 2 hours before going to sleep. Our internal signals aren't limited to plumbing and hydration. We also apply highly unrealistic expectations to our physical connections, driven by a cultural myth that a healthy, long-term marriage requires constant, spontaneous sexual desire. The reality is that baseline levels of physical desire naturally fluctuate between partners. Chronic stress, health changes, and evolving life circumstances continuously adjust those baselines over the years. This flowchart illustrates a psychological framework known as responsive desire. For many individuals, especially women, physical desire does not spontaneously exist before intimacy begins. Instead, desire is generated during the act of intimacy itself. Acts like cuddling, kissing, and open communication initiate the sequence, creating an emotional connection that actively builds physical arousal as the experience continues. Couples who successfully maintain a physical connection over decades do so by intentionally scheduling time for this process. They set aside uninterrupted blocks for intimacy and introduce small elements of novelty, like changing routines, to keep the sequence active. A temporary lack of a spontaneous spark does not indicate a failing relationship. Intimacy operates much like an engine. It often requires a deliberate, emotional push before the gears engage and it starts running on its own. The human body and mind are not static machines fixed to a single setting. They are dynamic, highly adaptable systems that constantly recalibrate their hormone levels, hydration capacities, and emotional baselines. Expecting a 55-year-old bladder to perform exactly as it did at 20, or demanding a decades-long marriage to perpetually mirror the spontaneous rush of a new romance, is fighting a losing battle against normal biological mechanics. Achieving actual wellness means leaning into those mechanics through simple, continuous calibrations. You adjust your late-night fluid intake, you glance at the color of your urine, and you openly communicate your changing relationship preferences with your partner. You do have to watch for the true outliers. Sudden, extreme shifts, like an unquenchable thirst paired with highly frequent urination, are genuine alarms that point to medical conditions like diabetes, and those require immediate attention from a doctor. But for the vast majority of our daily lives, the signals are working exactly as intended. By learning to accurately decode the invisible, physical, and emotional metrics our bodies produce, we stop fighting our natural biology and finally take informed, confident control of our long-term health.